So
That's important you say that because I think no matter what diet you pick and what you want to do, you just have to
mhm.
make sure it's something that's sustainable with your life and your lifestyle.
Yeah.
If it's someone who's working three jobs and, it's hard for you to cook all the time and that kind of thing. So just make the choices that'll work for you long term. It's a lifestyle change.
Right. All right, I'm going to introduce my favorite gastroenterologist, Dr. Nina Nandy. She's based in Austin, Texas, and host of AGA podcast Small Talk, Big Topics. Dr. Nina Nandy was on with me before on another episode, which was based on runner's gut. So, Dr. Nina Nandy, welcome back to the show.
Thank you so much for having me back.
Yeah,
I'm
well,
excited to be here.
thanks for coming back. And I think the conversation that we're going to talk about today is kind of expanding on what we talked about with runner's gut.
Mhm.
We're talking about the impact of diets on the digestive system. So I think that's something that's really important for a lot of listeners, especially runners, to
Yeah,
understand because dieting and running sometimes can go hand in hand. So I think that this will be beneficial for right many people. So. Um,
absolutely. It's a hot topic.
I guess I get started. So, how does a diet impact a person's digestive system, the mechanics of how a person's digestive system works?
So just diet in general, how
Right.
that works in terms of gut health,
Mhm.
it impacts your microbial diversity. So we've all heard about the gut microbiome, the balance of the good and the bad bacteria.
Mhm.
So depending on what type of diet you consume, that can encourage the growth of beneficial gut bacteria, promoting a diverse microbiome. And we'll talk about that with what foods in particular, like high fiber. And then also overly restrictive eating or eating lots of processed food, trans fats that can negatively impact gut diversity. And then, your diet can sort of change how the microbiome adapts metabolically. Like if you give your gut a break by eating less frequently, that can
Mhm.
enhance digestion and absorption. And then, of course, what kinds of nutrients you have in your diet that can affect your gut health as well. If you have very low nutrient content, obviously it affects it negatively. If you have fiber, vitamins, minerals, that's important for maintaining a healthy gut lining and also the supporting the microbiome. And,
Right.
I think we'll talk a little bit about reducing consumption and skipping meals, and that can affect the hormones that regulate appetite and digestion too.
Right, and I'm glad you mentioned that. Reducing meals. I guess one of the diets or one of the fasts out now is intermittent
Intermittent
dieting,
fasting, yes.
intermittent fasting. Can't get it out, right? How does something like that, I guess, impact a person's gut? Is it bad for them to restrict themselves from eating what they normally would eat on a regular basis?
Yes, I think it depends. And it depends how you're doing the intermittent fasting. There are many different types of, like how many hours to eat and how many hours to fast that are out there. And so I guess we can kind of break it down by potential positive effects and potential negative effects. So
Hmm.
things that can be good about intermittent fasting is giving the digestive system a break. And that can
Hmm.
promote better gut health and efficiency. This rest period allows the gut lining to repair itself and rejuvenate itself. There are some studies out there that suggests that intermittent fasting can positively affect the gut microbiome and enhance microbial diversity. Um, and some people report improved digestion, less gas, less bloating, probably because they're eating slower and they are giving their gut more time to digest. They're not getting the overeating syndrome.
Right.
And there's also some evidence that intermittent fasting shows lower levels of gut inflammation, and that can
Mm.
help alleviate conditions like inflammatory bowel disease.
Wow.
And yeah, very interesting. And but then, there are some potential negative effects. So everything out there, you should take with a grain of salt, so to speak, not too much salt. But so there's digestive discomfort. Some people get constipation,
Mm.
if they're not having enough fiber or if they overeat. Sometimes you might be fasting, but when you do eat, you're eating too much, you're eating the wrong thing. So it kind of
Right.
depends on what you're doing in that time. If I've had friends tell me, oh, if you do intermittent fasting, you can just eat whatever you want in that eight
Yeah.
hour period, but that's not true.
Yeah.
Um, some people, if they're not doing it mindfully, they're not getting the right nutrition. And then some people can get an increased stress and anxiety and overeat, like I said.
Right. And that's the thing I think that scares me with intermittent fasting is, I mean, and I've tried it before, and um, I guess it depends on a person's willpower. So if a
How
person,
did it work for you?
it it worked out fine the first few weeks. And then
Yeah.
once I got to week 3, I was kind of I wouldn't say sick of it, but you get to the point where you once you start to see the benefit, meaning the weight loss, and um, you feel good from not having, like you said, you're saying a lot of the heavy things on your gut. You feel like you can cheat a little bit, and then when you
Hmm.
cheat a little bit, which I did, I cheated a little bit. I started to use those 8 hours or 6 hours, I think, that I was doing, is trying to make up for the other hours that I wasn't eating. So other than
Exactly.
eating throughout the day, like you said, I was hoarding a lot of food during those hours that I can eat. And actually I started to see myself gain a little weight towards the end of it before I switched back to just having, my regular meal plan. So
That's important you say that because I think no matter what diet you pick and what you want to do, you just have to
mhm.
make sure it's something that's sustainable with your life and your lifestyle.
Yeah,
If it's someone who's working 3 jobs and, it's hard for you to cook all the time and that kind of thing. So just make the choices that'll work for you long term. It's a lifestyle change.
right. And I heard you speak of things, the specific foods to eat, like the high fiber foods. A
Yeah.
person that has a sensitive stomach, and I know we touched on this with our runner's gut topic.
Yeah.
Is there a specific diet that's friendly to the digestive system that you would suggest for someone with a sensitive stomach
Yeah,
to be on?
absolutely. So we see a lot of patients with irritable bowel syndrome.
Hmm.
And irritable bowel is basically, we call it a functional disease because we don't see structural issues, but that doesn't mean something isn't going on a more molecular level that we can't test for. So
Right.
so folks with sensitive guts, one of the biggest things is a low FODMAP diet. And that's a mouthful. It stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. It basically means carbohydrates of different types that can ferment and cause gas and bloating. So common high FODMAP foods are like apples, pears, like really sweet fruits, fake
Mm.
sugars, certain vegetables like onions, garlic, cauliflower, broccoli, that kind of thing can be hard on people with sensitive guts. And so we
Wow.
usually have folks, yeah, they sort of eliminate all those foods. We have a whole list and a picture. They eliminate those foods for 2 weeks and they sort of slowly introduce things back and see what's their trigger. Because you might have a sensitivity to one type of carbohydrate, like a fructan, for example, but
Hmm.
be fine with other kinds. And a lot of those vegetables are good for you in other ways, but you just have to kind of figure out what works for you. And then obviously if you have celiac disease, you're going to be avoiding gluten, and some people are lactose intolerant. In general, foods that are gentle, you want to
Hmm.
focus on foods that are easily digestible, like rice or whole grains, like oatmeal, bananas, soft fruits. Cooked vegetables are easier to digest than raw vegetables, like
Hmm.
carrots, zucchini, and spinach. But you don't want to overcook them because then you're kind of leaching out all the nutrition.
Okay.
Lean proteins are good,
Okay.
chicken, turkey, fish, eggs, if you're not allergic, because I do want to make a point that the 6 most common food allergens are
Hmm.
wheat, soy, egg, dairy, tree nuts, and shellfish. So, sometimes if you're sensitive, maybe it's a food allergy too. Also, if you're sensitive, eat small, frequent meals. Don't eat a whole lot at one time because that's going to make you more bloated. And especially people who have diabetes, the it affects their digestive tract as well. And so they can have what's called gastroparesis, which
Okay.
means the stomach doesn't empty fast enough. And so, and one more thing I'll say is common things, avoid the common triggers that make your gut feel worse, which is like spicy food, which I will never give up. High fat foods, caffeine, alcohol, and carbonated beverages like
Well, it's okay
sodas.
to cheat sometimes,
Yeah.
right? You can A person
Yes,
with a
yes.
system, they can add in that here and there. Is that right? Or
Of
is that
course. I
something that
think
you're saying? Okay.
life is about moderation and you have to
Yeah.
enjoy your life as well. So you can't restrict yourself all the time. But if
Right.
you are a person that you know that you're triggered by certain things, just be aware of that, and just say, you know what, today I'm gonna feel the burn, so to speak, but I really want to eat spicy food.
You're gonna
Okay,
pay
that's
for it.
fine.
Yeah.
Yeah, but there's
Yeah.
there's things you can do to sort of protect your gut lining if you're gonna do that.
Okay. Is that kind of a hybrid type thing? So let's say I know that I may suffer from IBS, and like you
Yeah.
said, this is certain foods that I can eat that will calm my stomach down. Can I have that day or two where I know, like, look, this is gonna be the day where I'm gonna eat that spicy food, that spicy rice, or whatever your whatever your vice is. But tomorrow I'm gonna get back onto my foods that calm my stomach. Is that hurting like the stomach lining with a
No,
person
I
doing
think
that?
everything in moderation, right? I mean, I think that if you're generally, following the FODMAPs or whatever is your triggers, once in a
Mhm.
while, I think you can have a cheat day. It's just depending on how severe your symptoms are and how much
Okay.
they affect your life.
Okay. And how would someone test for something like that if they feel like they have those type of stomach issues? They come and see someone like you. Is there a specific test that
Yeah,
they
I
need to
mean, they
take?
can see me or somebody like a nutritionist as well. So we test for,
Mhm.
things like celiac disease because that's an actual antibody against the gliadin, which is in wheat.
Okay.
Food allergies, there are not true allergies like anaphylaxis, a person will know, like a shellfish, they can't breathe, their throat closes up, that kind of thing that they would know
Okay.
about. There is food allergy testing that's kind of debatable. How specific that is. I do have a lot of patients that come to me that want to go see the allergist and get food allergy testing.
Hmm.
But it's a different type of allergic reaction. But yes, they can come to see me, their primary care. We could do like a food journal and kind of figure out what are their triggers. People generally know if they're lactose intolerant, but then there's tests for that. There's a
Hmm.
lactose intolerance test, there's a sucrose intolerance test, there's many different things.
Now, when it comes to when a person commits to a diet, how long does it take for the digestive system to adjust to the new foods that is being introduced to it?
When you are adjusting to a new diet, of course, it depends on what kind of diet that you're doing.
Right.
And so initially, there's like an initial adjustment period, let's say like the first 1 to 2 weeks or so. Most people experience some digestive changes within the first week or two of adopting a new diet. And
Okay.
that can include symptoms like bloating, gas, or changes in their bowel movements as the microbiome starts to adjust. I know some people who did keto, like very strict, no carbs, and they would get sort of like a carb flu or feeling
Hmm.
foggy or having some cognitive slowness during that time. And then generally it takes about 3 to 4 weeks for the digestive system to adapt more fully. So we say long-term adaptation happens in about week 3 to 4. Your body
Hmm.
tries to improve its ability to process new types of food. The
Yeah.
bloating and stuff should get better. And then over 1 to 3 months, then you have significant changes in the gut microbiome. So let's say you increase fiber or you have probiotics, which we'll talk about, or fermented foods, then that can improve the growth of like the good bacteria. And so
Wow.
that's in general kind of sense, but based on your age, overall health, if you have any other digestive issues, then that might affect it.
And you brought it up, probiotics. Um,
Yeah.
can that introducing probiotics into your diet, how does that help that digestive tract, process food?
Yeah, absolutely. So probiotics are beneficial, and it's important to know that not all the probiotics out on the market are created equal. You have to look for the right kinds. So something like Align or Culturelle or Florastor, which have been proven to have the right balance of good bacteria, that will help improve the balance of gut bacteria and boost the
Okay.
immune system and improve digestion. So I just want to say one quick thing. Probiotics versus prebiotics. A lot of
Hmm.
people ask me about that. So probiotics are the live microorganisms like bacteria or yeast that are found in foods like fermented things like kefir and yogurt, kimchi, sauerkraut. And then
Hmm.
prebiotics are like non-digestible plant fibers that are the substrate that feed the good bacteria in your gut. So you're giving them the stuff that they like to eat, and that's like artichokes and chickpeas, oats, asparagus. A lot of the good vegetables will feed the
Those are the
good
things
bacteria.
that go through the system, and you'll see it on
Yeah.
the other end, basically. Yeah.
Yes.
Okay. I'm glad you mentioned prebiotics. It's something I've really never paid attention to, of
Yeah.
how they work together. Is there, I guess, a balance between the two, doing both pre and pro? Does marrying those two together help you even more, or if you
I think
separate them?
so. I think in general in the GI clinic we have people take probiotics, so that take the
Okay.
actual bacteria, because a lot of the disorders they come in with are an imbalance of the good and bad bacteria to begin with. So
Hmm.
this way they're just getting that bacteria back. Because if you don't have the good bacteria to begin with, and you're just eating things that are a substrate, there's nothing there to process it. So I think probiotics are very helpful.
Okay.
And then prebiotics in general, if you're eating a good high fiber diet with plenty of fruits and vegetables, you should be getting those.
Okay. Okay. Switching gears on you here
Yeah.
and getting to a controversial topic where I feel like it's controversial.
Oh, I think I know what's
Yeah,
coming.
I know, I know. So, how does drugs like Ozempic is a really
Yes,
popular weight loss drug?
it
How
is.
does something like that impact your gut?
Sure. So these are, the types of drugs called GLP-1 inhibitors. So that's like
Hmm.
Ozempic, which is semaglutide, and Mounjaro, and some other ones on the market. So
Yeah.
there are many effects on gut health, and I will tell you kind of some of the potential positive and potential negative things. So
Hmm.
some of the good things it can do, um, you're losing weight, so that's enhancing insulin sensitivity. And people who are diabetics, that's very beneficial. It can reduce inflammation and benefit the gut health and overall metabolic function.
Right.
Also, losing weight can reduce some GI symptoms like reflux disease, which we kind of talked about with the runner's gut episode,
Hmm.
or even IBS and things like that, because they feel like the weight loss can contribute. And then good gut microbiome. But let's talk about some of the negative things too. So if the weight loss occurs too quickly, you
Hmm.
can get nausea, diarrhea, constipation. A lot of people feel full because it's kind of mimicking gastroparesis. So you feel full, you feel nauseous, you don't want to eat. So some people are just not getting enough nutrition that way. Um,
Right.
so it slows your gastric emptying, basically, and that can change nutrient absorption. And
Wow.
then, it really depends on the individual and their baseline health and what they're eating, their dietary choices. And then there's some potential reports of pancreatitis where the pancreas gets inflamed. I'm sure you've seen that in the literature
Yeah.
when you're on things like Ozempic.
Yeah.
So it's best to have it monitored with a healthcare professional, yeah, if you're going to start something like that.
Yeah, and I agree. I know there in my area, probably nationwide, where there like shortages of it because so many
Yeah.
people are taking it for weight loss, and anything that and not to say there's anything wrong with it. I tend to agree as long as you consult your medical professional that that's the best route to take. But um, I guess I always would want a person to proceed with caution with any drug that'll impact you to the point where you're drastically losing weight. Because I've heard of instances where people are dropping like 20-25 pounds within a few
Right.
months. So yeah, and again, something like that. If a person is losing a lot of weight on drugs like that, is that putting any added stress on that digestive tract? I mean, the combination of the drugs and the weight loss, is that putting added stress there?
Yeah, so I think if the weight loss is too rapid, of course, the nausea, diarrhea, constipation, that your gut is telling you that, hey, this is, something that's unusual, and
Right,
I'm letting you know about it, getting those bloating symptoms.
right,
And there are changes at a hormonal level of what it does and regulating satiety and how we feel full and things like that. And there's some data that shows that, if once you stop those drugs, the weight gain can come back and other things if you're not making long-term dietary changes. Some people use it kind of like a quick fix and aren't changing anything else that they're doing
right,
in their life. And so as soon as they stop they can start getting very, very hungry and the weight can come back.
right. And there, in I guess towards the same line of thinking, far as when we were talking about like Ozempic, you have surgeries out there that people can get that can shorten like the digestive tract.
Yeah, so like
Um,
gastric bypass sleeves
Gastric
and
bypass.
long, yeah.
Yeah, now um how does that work when you have the gastric bypass, and perhaps, again, if I'm asking a question that's like outside of your
No, no,
expertise or whatever,
we deal with this too,
yeah,
yeah.
how does that impact you when you're dieting? The person that's had that, is it a person that has to be a little bit more conscious when it comes to what's going into their stomach, going into their gut?
Yes. So the important thing in terms of gastric bypass is to know if the procedure is what we call restrictive or
Hmm.
restrictive and malabsorptive. So something like a gastric sleeve where part of the stomach is excised and removed to make that stomach pouch smaller. That's what's called a restrictive procedure. So you're just making
Okay.
things smaller so you can't eat as much. You have to be careful in terms of what you're eating, the amount of nutrients. You can get full really easily, feel bloated and sick and nausea,
Wow.
vomiting. Or if you're eating too much over time, it's going to stretch out that pouch and make the stomach big again and kind of reverse the whole point of having surgery and people gain the weight back. Now,
Really?
something like yeah. So people, if they're not following the bariatric diet, there's a very specific diet you have to be on kind of before and after the surgery.
Okay.
And sometimes people don't follow through for whatever reason, and it's not
Wow.
as effective. And then the other sort of surgery, I mean, there's many different ones, but there's one called Roux-en-Y. And that one is not only restrictive, but also malabsorptive. So part of your small intestine is stitched onto your stomach. And so you have issues with vitamin deficiencies, especially iron deficiency. So
Wow.
folks who have that procedure need to be on special supplements.
And I guess I think about, well, if things are shortened or restricted,
Yeah.
the stomach lining, and again, this is me coming at layman terms. The stomach lining is not getting, like you're saying, the nutrients that it need to get because things
Yeah.
are getting out there fast versus staying in there doing what it's supposed to do.
You can have dumping syndrome is a thing that happens where you eat fast and you just have diarrhea after because it's shorter
Oh,
and you're not absorbing. And the other thing is you can get ulcers that form, especially in a Roux-en-Y, where they stitch the small bowel to the stomach because there's not good blood supply there. So
right.
you can get what's called a marginal ulcer, or an ulcer caused by not enough blood flow or ischemia. So
Okay.
for sure, you're absolutely right.
Wow. Yeah, that's there's a show that comes on, I think which channel, like Health TV or something, where a doctor does that, and this is mainly for people that are really overweight,
Oh yeah.
and it helps some of them, they end up relapsing and coming back. I guess I never thought that since you're shortening the digestive tract, things could still get out of whack and widen. It's just amazing to see how the human body can
Yeah,
still adjust
absolutely. I mean,
ways.
weight loss, I think, is so multifactorial. There's so many biopsychosocial elements that go into it.
Yeah,
And that's why you need a good comprehensive bariatric center with a nutritionist and a psychiatrist, and just making sure you're able to make those changes, because once those changes are in your body, that's permanent. But if you don't
yeah,
do the lifestyle changes, it can come back and you can have more complications.
yeah, I agree. Um, so your opinion, what's the better dieting strategy? Cold turkey or easing into it?
Well, I think no matter what you do, always easing into it is better.
Okay.
Taking things slow, taking things easy, letting your gut adjust. And I'll tell you why. So, when you slowly introduce new foods or reduce certain foods, that allows your digestive system to adapt more comfortably and
Right.
minimize symptoms like bloating or, nausea. Um, and so sudden changes can overwhelm your gut. You'll get the runs or the other, constipation.
Yeah.
And then just if you do things slowly, it gives you more time to monitor reactions, and you can say, hey, that specific food, is giving me issues, and I can adjust better. And then also, like, if you do it slowly, it helps you psychologically and maintain motivation, because if you stop cold turkey, you just feel deprived sometimes.
Yeah.
And you can sometimes have increased cravings.
Yeah. Yeah. I have to agree with you. There's some
Do you have
people that
personal experience with
yeah,
this?
yeah. Well, I just mentioned it, right?
Yeah, yeah.
I've tried it. I've tried the cold turkey thing, and here's I guess the issue for most runners that I think a lot of us a lot of people that work out, not only runners, can relate to. My body has gotten so adjusted to me running, maybe 20 miles within a week.
Yeah.
Um, I can run 20 miles within a week and not lose a single pound. It's because I'm just used to that. If my eating is over what it needs to be, then I'm going to gain weight, even though
Even
I'm
though
running,
you're exercising so
even though I'm
much. Yeah.
exercising so
Yeah.
much. And it's a delicate balance of making sure that I'm getting the right workout in and making sure that I'm eating right. So I would say it's 50-50.
It's
And
really interesting.
yeah,
Yeah.
and for people that I think that don't exercise as much, and probably on the eating side, the eating is probably a little bit better. I believe that they can lose just as much weight by running less miles and just
Yeah.
adjusting their eating. So again, this exercising, running, whatever type of fitness activity that you're doing, I think is important to marry both the diet and your exercise to make sure that you're
100%.
getting
When I was
weight.
getting my obesity medicine board certification in
Mhm.
ABOM,
Mhm.
it was actually kind of mind blowing how much we think we know about nutrition and weight loss, and but we don't, because your body will just set a new set point. Like just
Yeah,
we used to think, calories in, calories out, and that was how
yeah,
you lost weight. But if you restrict yourself too much, your body says, hey, are we starving? Let's hold on to all of this, like we don't want to die. So,
Yeah.
it
Yeah.
makes it harder to lose weight.
Yeah, and yeah, it's a good point because I like it's hoarding. So
Yeah.
after I run, or if I've run a long distance, anything really over, I say 7 miles is a really long distance for me. I tend to reward myself with if I'm going out running with a group of runners, we usually a meet up at a breakfast spot afterwards, and like the calories, you don't even think about it because you feel like, oh, I've already ran it off. But in reality, you can eat, and I have eat as many calories that you've burned during the workout, and it's just like you didn't do anything that morning. I ran 12 miles, but I end up eating 2,000 calories at breakfast. So it's like, all
But
that's
it's good
gone.
for your cardiovascular fitness. Your heart
Yeah.
appreciates it, I'm sure, and
Yeah.
you're increasing bone density. So there are so many other benefits of exercise. So
Yeah. All right. So I'm gonna name some diets off to you.
okay.
All right. So, and I'm gonna get the advice of a gastroenterologist, the most famous one that I've ever spoken
Oh my gosh.
to.
How many do you
Yeah.
know?
Yeah. Yeah. Hey, that's not the name of it, right? All
I'll
right.
take it.
So I'm gonna name a few diets.
Okay.
And it's not necessarily a quiz. I'm just trying to get an understanding of if you had to rate these one through, it's only four that I have on here.
Okay.
Which would you consider the best diet for a
Okay.
person that is trying to make sure that they are promoting a healthy digestive tract? So let me know when you're ready.
I'm ready.
Okay, so I'm going to name them off. You don't have to give me the order yet. I'm just going to name them all off. And if you need me to include what's entailed in the diet, I'll give you that information too.
Okay.
All right. So, all right, paleo diet,
Okay.
the vegan diet, intermittent fasting,
Okay.
the Atkins diet, the low
Hmm.
carb diet. So I'm going to repeat that again: the paleo diet, the vegan diet, low carb diet, intermittent fasting, and the Atkins diet. So
Okay.
if you're rating those, rate which
I can
one.
only pick those. Okay.
Yeah, you only can pick that.
All right.
That's where we're going. We're only picking those. So
Okay, so I think this is a hard question because, and I'm going to try to answer it. It's a hard question because it depends on what you're eating within all of those diets as
okay.
well. But I do know that, Atkins is considered kind of like a keto, right? It's a low
Hmm.
carb, high protein diet.
Yep.
And so that can be difficult in terms of cardiovascular fitness because there's a lot of high fat. I know there's like a bacon and eggs in the morning, no bread, that kind of thing. So
Hmm.
that's not my favorite. I would say maybe vegan or plant-based would be higher up in the list.
Okay.
I think that plant-based diets, focusing on whole plant-based foods can enhance microbial diversity. However, you can eat a lot of vegan stuff that's processed. Just because it doesn't have animal products in it doesn't mean that it's good. So it just depends on whole grains. And then the other one is paleo, is sort of like as our ancestors ate.
Right.
Uh, nothing processed, nothing refined, meats and vegetables. I think in the purest sense of the word, that's pretty good, in terms of having no refined sugars, no refined carbohydrates.
Hmm.
Um, I think that's up there because you're trying to stay away from things that are processed. I
Right.
think, in terms of intermittent fasting, we kind of talked about that, and it depends on what you're eating during the times that you're able to eat. Um, and so that one's kind of a free for all because there's so many variables. And I think, if I had to pick one, well, not on the list, it would be the Mediterranean diet because that's
Okay.
a diet that's rich in fruits, vegetables, whole grains, nuts and seeds, and healthy fats like olive oil. And it's similar to paleo, I guess.
Yeah.
We use this a lot for people with fatty liver disease to help them lose weight. And it's sort of like what you can do. Like I said before, what you can do to really sustain a lifestyle change.
Right.
Um, not something that feels restrictive and feels like I can't maintain it. So I would say probably paleo slash Mediterranean is pretty good. And then plant-based if you're doing the whole plant-based foods, um, and not the processed, veggie patties and things like that. And then I would say Atkins and then maybe intermittent fasting last, just because there's so much variability. It can be good, but it just depends on what you're doing with it.
Okay.
So I don't know if I answered that well
No,
enough because
no,
it's
you
hard to
did.
categorize.
No, no, you did. Folks, you heard it
Okay.
here. You heard it here first. It is paleo slash Mediterranean, says Dr. Nina Nandy. So yes.
Yeah.
Yes. So
Well,
you,
and take that, with consideration and
yeah,
moderation, don't
moderation.
overdo it. And like I said, these are my opinions and, not necessarily, research driven because there's so much data on
Right,
diets, that it's hard to get like good clinical studies. But, best thing, moderation, whole grains, fruits, veg, lean protein,
right. Okay.
fiber.
Well, Dr. Nina Nandy, thank
Yes,
you
sir.
again for being on the show and blessing us with knowledge as you always do.
Thank you.
I know that you're going abroad and you're
I
traveling,
am.
so safe travels
Thank
and
you so much.
yeah, and good luck to you and all you do. And folks, please check out Nina's podcast, which is Small Talk, Big Topics, an AGA podcast. Really good listen.
Thank you.
Again, Nina, thanks for joining me on the show today.
Thank you so much for having me. Always a pleasure.
Yeah.